Michael Jackson's drugs. We're going to take a look at them with the doctors who administer them. In hospitals, not in homes. That's next. Before we meet our anesthesiologist, let's check in with Anderson Cooper, who'll host AC 360.
Right, we welcome
Dr. Vimal Lala. He's an anesthesiologist and pain management specialist, medical director of the Advanced Pain Medical Group in West Hills. And Dr. Jason Himes, anesthesiologist, pain management specialist, medical director, conservative care specialist, medical group. We're going to talk about the medicine that Dr. Murray purportedly gave Michael Jackson in the last hours of his life. He injected him with 10 milligrams of Valium, 2 milligrams of Ativan, 2 milligrams of Versed, 2 milligrams of Ativan, yet another 2 milligrams of Versed, and then 25 milligrams of propofol. We have this with us, right? Will you tell us what we have here, Dr.
Sure.
Lala?
What we have here is diazepam, or Valium, injectable form.
This is Valium, and this would be injected, right?
It could be, that form is injected. But you
Given
can also,
before surgery?
normally we do not give that medication before surgery because it lasts for a long period of time, what's called a long half-life.
This is to settle someone who might be nervous, Dr. Himes?
It's a tranquilizer.
Yeah. Next.
Sure. Midazolam or Versed.
Boy, what a small little bottle.
It's very potent.
Potent how? What would it do?
It's a very short-acting, potent version of the Valium that you saw. They're all relatives of one another.
Very small. All right. What's the pill?
And this is Ativan.
Now, he took this as an injectable, right?
That's what was reported. I believe.
We have it as a pill. What does it do?
It, too, is a relative of the other two. It actually is a substance that is converted in the body from Valium. So the Valium is converted in the body to Ativan. They're relatives
Would
of
you
one
be
another.
giving, I don't know, well, I guess Valium would be given in the home, wouldn't it?
Valium and Ativan are both tranquilizers.
But
And
not the other.
The midazolam, the Versed, is really for in hospital or surgery center use.
And now the world-famous propofol. All right, Dr. Lala, tell us about this.
Propofol is a medication only used for anesthesia to actually induce anesthesia for a patient undergoing a surgical procedure. It is only indicated for hospital, OR usage, ICU usage, or ambulatory surgery centers.
Put you to sleep while they do the surgery.
Absolutely.
And it's very quick acting in that when you wake up, you're up.
You're up.
You know, what's interesting, you said it puts you to sleep.
Doesn't it?
That's really a misnomer. It doesn't put you to sleep. What it actually does is anesthetizes you. When someone says that I went to sleep for surgery, they didn't go to sleep. There's a real big difference between sleeping, a natural process, and being under anesthesia, a very unnatural process.
So you have to be monitored, right, Doctor?
You have to be monitored.
Blood pressure taken,
Blood
oxygen
pressure,
nearby.
oxygen, carbon dioxide levels, EKG monitors, very important.
When you heard that it was given in a home, what did you first think, Dr. Himes?
Amazing. It is the sort of situation where you would think that the people administering it, who I presumed at the time would know how these things work and been trained to use them, would steer clear of that kind of situation. But what you have is someone who apparently wasn't necessarily trained or familiar with the uses, and so therefore stepped into a very bad situation.
How would it get into the house, Dr. Lala? I mean, how?
Well,
Would the doctor have to bring it there? You don't go to a drugstore and get this.
No, absolutely not. Not even a general doctor can prescribe that. This is a medication that only surgery centers or hospitals can get. So the physician have had to have some connection to either a surgery center or a hospital in order to get the medication.
Improperly handled, it could kill you.
Absolutely.
Yeah. Back with more right after this.
This is CNN.
All right, Dr. Lala, tell me about this needle.
This needle is what you see is an intravenous line. It's what we actually place inside a vein in a patient who is about to undergo any type of surgical procedure. It's how we administer fluids and medications.
But this doesn't go right at the skin, doesn't it? Isn't there another thing they put in first and then this goes in?
Oh, no. That is actually the needle, and the catheter is over the needle. So the needle goes into the skin, and then the catheter is threaded into the vein.
We don't show this to patients, do we?
We do, actually.
You do?
Yeah.
Not me, you wouldn't. Now, you're an addictionist as well, Dr. Himes, right? Which means?
I'm boarded in anesthesia, pain medicine, and addiction medicine.
Can you explain why someone would be using all this?
Well, there are a lot of answers to that and a lot of reasons. But probably the basic problem is celebrity medicine, taking care of people that you are afraid to say no to.
What does it do for them?
Well,
if it puts them to sleep, that's it?
Well, it doesn't put them to sleep. What you have, if you read this sequence of events, everything was done by the textbook. Unfortunately, it's a textbook for something else. This is a textbook for putting someone under anesthesia to have a surgical procedure done on them. Not for
why would someone have it done not for a surgical procedure?
Well, that would be hard to figure. Clearly, notable people can drive their own medical care. Physicians, other people caring for them. Absolutely, absolutely. Physicians that take care of celebrities, those of us that have had to deal with these situations, are faced with ethical questions that the average physician may not come up with.
Do pharmacies face it too, Dr. Lala? Famous person comes into a drugstore?
They may, but I'm sure that a pharmacist cannot give a medication unless it was prescribed by a physician. So I think that it's the physicians who sort of put themselves in a vulnerable position and befriend celebrity patients and become their friends and start doing things that they normally wouldn't do.
So for protocol, the physician would have to bring that from the hospital to the house, wouldn't he? He wouldn't get it in Walgreens.
No.
Ordinarily not.
There would be no reason Walgreens wouldn't have it.
No, Walgreens wouldn't stock it, but that doesn't necessarily mean it couldn't be ordered from some supplier or something like that.
So when you first heard of this, Dr. Lala, did it boggle your mind?
Oh, absolutely. I was shocked.
So all of what he got that night was pre-surgical.
Pre-surgical medication. I mean, the major surgical medication he was given was a propofol, but it has to be noted, in a lot of the reports it was stated that he was given 25 milligrams of propofol, and toxicology results are showing that this is a lethal dose. I can tell you, 25 milligrams is a very small dose of propofol. Of course, when it is given combined with all of the other benzodiazepine medications, there's a synergistic effect, but it was a very small dose.
Dr. Himes, wouldn't any doctor know this was dangerous? Not an anesthesia, any doctor.
You know, what you're seeing is really the tip of an iceberg. What's interesting is in talking to some of my general anesthesia colleagues, they're upset over the concept that there was a propofol overdose here and blaming it on that. That's really not true. The amount of propofol given was relatively small. What you see is the tip of an iceberg. It's the fact that drugs were given that will hang around in the body for hours or even days. The half-life, that means how long half of the drug will be in the body. For Valium here is 3 days. And so what happened is the musical chairs of the drugs that were being given, the last drug given before everybody sat down, or in this case died, was propofol. But it was a whole sequence of events. And unfortunate.
We're almost out of time. If you gave all of this to me now, in 2-hour spaces, would I probably die?
If myself and Dr. Himes weren't here to resuscitate you, yes.
Thank you all very much. We'll be calling on you again. See you tomorrow night. Time now for Anderson Cooper and AC 360.